Aortic regurgitation is famous for its hyperdynamic physical findings, caused by a large stroke volume being ejected into the aorta followed by a rapid fall in pressure as blood flows back into the heart. Examination of the upper extremities and head reveals the most classic peripheral signs. In the hands, you may observe Quink's sign, which is a visible pulsation of the capillary bed in the nail beds, and the water hammer pulse or Watson's pulse, characterized by a rapid, forceful upstroke followed by a sudden collapse. If you raise the patient's arm, Maine's sign may be present, a drop in diastolic blood pressure of more than 15 millimeters of mercury. Moving to the head, the de Musset sign is seen as a rhythmic nodding of the head in time with the heartbeat. The eyes may show Landolfi's sign, which is called pupillary hippus or Becker's sign, characterized by pulsations of the retinal arteries. The face and mouth can exhibit the lighthouse sign, forehead flushing, Muller's sign, pulsating uvula, and prominent carotid pulsations known as Corrigan's pulse. Cardiac auscultation hallmark of aortic regurgitation is a high-pitched, blowing, decrescendo diastolic murmur. It is best heard with the diaphragm of the stethoscope while the patient is sitting up, leaning forward, and holding their breath in full expiration, and typically radiates down the left sternal border toward the apex of the heart. The murmur is loudest at the left sternal border in the third and fourth intercostal spaces. Sometimes it is also heard at the aortic area in the second right intercostal space. You might also hear an Austin Flint murmur, which is a low-pitched rumbling diastolic sound at the apex, caused by the regurgitant jet displacement of the mitral valve leaflet. As you move down the body, the arterial pulsations remain strikingly visible and audible. Over the internal organs, you might detect Rosenbach's sign or Gerhardt's sign, which is the pulsating of the liver and spleen, respectively. The femoral arteries provide several clues. Traub's sign refers to pistol shot, sounds heard over the artery, while Durizzia's sign is a to and fro murmur heard when the artery is lightly compressed with a stethoscope. Perhaps the most sensitive indicator is Hill's sign, when the systolic blood pressure in the legs is significantly higher than in the arms. Finally, in the lower extremities, you may find the Lincoln sign characterized by pulsatile popliteal artery and the Sherman sign, where the dorsalis pedis pulse is unusually prominent in elderly patients.